Okay, this video is a question. Are hospital inspections a joke? Every hospital has inspections. There's always some inspectors from different organizations that come by to make sure everything's up and up to standard. And they look at the big standard items. They look at the crash code. They look at the crash card for Code Blues. Does it have all the required supplies? Have the surgeons, written their post-op notes, dictated their surgeries. Okay, that's nice. But what's the most powerful thing a hospital inspector could do to improve patient outcomes? There's nothing even close, by a factor of like 1,000. The most powerful thing they could do would be to make sure the doctors and the nurses and the technologists, the physical therapists, the dietitians, that they all know the basics of nutrition, that they know the benefit of the low-fat vegan diet with no oils to prevent obesity, hypertension, diabetes, coronary artery disease, etc. How often do they check for that? Never. And you would say, well, what would the inspector say? The inspector would say, look, we're here to check things like, we talked about the crash card for Code Blue, etc. We're not here to check nutrition. That is the responsibility of the dietitians. Okay, so then you walk over and you talk to the dietitians. And here's the reality. The dietitian schools are funded by Big Food. And Big Food teaches them that big food and processed food is okay. So in reality, dietitians almost never know hardly anything about nutrition. I made a video about some dietitian, like what she eats every day. It was ridiculous junk food. And the typical thing you'll see in the bigger universities is that the dietitians recommend a Mediterranean diet. But the Mediterranean diet, it's for chumps. I call it the Antichrist because it promises salvation, but it doesn't deliver. The Esselstyn diet is over 30 times more effective for prevention of coronary artery disease. So the final question becomes, well, in a hospital, in a medical clinic, who is responsible for knowing nutrition, epidemiology, and toxicology? And the answer is no one.